Hello, everybody. Thank you for coming out. We're super excited about today's presentation. Just a couple announcements before we begin. The first is just a reminder that we've increased the window to 48 hours. So make sure you take advantage of that and, you know, watch it. Also, make sure to follow us on LinkedIn and list us as one of your experiences. And also, everything Shellcast related is in our bio. So that means our YouTube channel, the current quiz form, and the LinkedIn and everything that we talk about is going to be there. Other than that, Dr. Mike, you can take it away.
All right, thank you, Magdi. So I'm gonna try to share my screen here real quick. It's saying it's not letting me.
All right, it should be working now. There we go.
All right, that work?
Yep.
All right. Hey guys, so I'm Mike Pavlisin. I'm what's called a general medical officer in the Navy. And I'm going to talk to you guys a little bit today about being in the Navy, what you can kind of expect if you decide to join the Navy, steps that you can take when you're a pre-med student, medical student, kind of explain what resident GME training's like. But I'm going to focus a lot on operational medicine because that's kind of what I've done for the past 4 years. But first things first, I'm not a recruiter. I really don't care if you guys join or don't join. All I can do is really tell you guys about what my experiences were. Whatever I say has nothing to do with what the Navy told me to say or reflect upon them. So yell at me, not them. And I don't focus on the fact that I'm in the Navy. Okay, so the Navy, the Army, the Air Force are all really different, and their experiences are different. I can talk a little bit about the Army and Air Force just from like friends that have done it, but really I know the most about the Navy because that's what I've done. So briefly, just my quick story. So I went to University of Missouri in Kansas City. I did a 6-year combined Bachelor MD program. I graduated that in 2017. I joined immediately when I got into med school. My dad told me to look into it. He's a dentist, and he kind of regretted not joining, and he just said look into it. So I did everything I could to look into it, and okay, it sounded like a good time. So I joined the Navy. After med school, I went and did my internship at Navy Medical Center Portsmouth in Virginia in internal medicine. And then after that, just after my internship only, I was told you're going to do operational medicine now. So I went with the Marines for 2 years and at Camp Lejeune, North Carolina. And now I'm in Charleston, South Carolina at a clinic at the Navy Weapons Station and Nuclear Power School. So I don't know how much you guys know or don't know about military medicine, but essentially you can join any branch, right? Navy, Air Force, or Army. The scholarship is called the HPSP program, all right? And essentially it's a pay for what you, or a get what you pay for. So if they pay for 4 years of your school, you owe them 4 years of time. If you do a deal where they pay for 3 years, and you owe them 3 years. Where this gets tricky is if you do a long surgical residency or a fellowship, then you can owe more than those years. But that's really kind of person dependent based on like what kind of contract you sign and what kind of fellowship that you do. So I'll kind of focus on just like the 4 and 3 model. Your training does not count as payback, right? So like if you do a internal medicine residency, those 3 years that you did do not count to your payback. You have to do 4 more additional years after that, okay? There's other corps, right? So when you're a doctor, you're in what's called the medical corps. We have these little things on our collar that shows like, hey, he's not a regular officer, he's like a doctor. But you can also do nursing, dental, physician assistant, pharmacist, physical therapy, psychologist, like everything in healthcare is in the military as well. So, if you decide like, oh, I really want to join, and we'll talk kind of about like how to decide that. But if you decide like, I really want to join, this is what I want to do, what you can expect as a student, first things first, okay, you get in, you accept it. I'm now in the military. Really, your job when you're in the military, when you're in school, is just study and graduate. Like, there's no, weekend activities you have to do or go anywhere. I'll explain officer school a little bit, but ultimately they're paying you to study, to pass, to become a doctor. That's it. That's all they expect from you. Throughout the lecture, I got some pictures of some people I was in Norway with. So these are just my corpsmen. Some of my corpsmen. Corpsmen are Navy medics. So, the Army, Air Force, I think the Army has medics. Never call a Navy corpsman a medic. They pride themselves on being more than that. So if you see a corpsman, they're a corpsman, not a medic. When you're in school, okay, so like I said, really, they want you to study, to pass, graduate, that's it. You get paid a little bit. So I think when I was in school, it was like the stipend, the monthly paycheck was like $1,800 a month. So depending on where you live, like that was enough for me for rent and food and whatever fun I wanted. You're not rolling in cash by any means, but it's more than nothing. And obviously they pay for your tuition, right? So I never even dealt with, I never even seen a tuition check, right? It's just the school and government took care of it and it's over. Other benefits, they pay for your books. They pay for your step tests, your step exams. You can sometimes, when I said that you don't have to do anything, right? So like when you're in classes, you focus on studying. Every year, okay, so once a year, you do have to go on what's called ADT. So it's like active duty time or tour. But really, it's mandatory because you're in the reserves, but you don't actually have to do anything, right? So like I would go on orders and get paid active duty money for that month to study and be in school. Now, when you're later in med school, like your second, third year, and you have to do officer school, which is a 5-week course. And for the Navy, it's in Newport, Rhode Island. You'll use one of your ADT months to do that. You get one ADT month a year that you have to use. You can also use your ADT month for rotations, right? So like if you want to go to Walter Reed or Portsmouth to do a rotation, they'll put you on active duty orders, so you get paid active duty money to do your rotations. And then when you're on active duty, you get all the benefits of an active duty person. So that's a little nice benefit. For residency applications, it's similar to being in med school than the civilian world. Who are all matching tomorrow, which is exciting. Except for you find out early. So like on my med school's match day, I had found out in December where I was going. So it's kind of anticlimactic, but it's still cool. And there's, I'm gonna talk a little more about this later, but the application itself is a little bit different, and what you can apply to in the Navy is a little bit different. So this last picture, when I was at officer school, there was a 4th of July parade in Providence, Rhode Island. So they made us march through the whole parade. It's kind of cool. And that's us, some of us just standing like in formation. People walking at the parade. So this is, I said different services, different expectations, different experiences. So this is where the branches differ a lot, okay? So I'm gonna speak specifically about the Navy here. When you apply your 4th year med school, all you're applying to is your internship, okay? You're not applying to residency, you're applying only to internship. Because in the Navy, every intern has to reapply to stay in that spot, okay? In the Air Force and the Army, it's more like you apply to residency, right? So if you get radiology, you stay radiologist, finish your training for the most part. The options that you can apply to in the Navy are actually way different than the civilian world. So the only options you really have, or at least you had when I applied, was psych, family medicine, OB-GYN, internal medicine, emergency medicine, gen surg, ortho, peds, and TY. You couldn't apply to plastics. You couldn't apply to ENT, ophtho, radiology, anesthesia. You can't apply straight out. The reason is because the Navy has what's called general medical officers, where they expect you after you finish your internship to go operational. Okay, I'll talk a little bit about that in a second here. And our intern years are a little bit different than most people's intern years because, I did internal medicine, right? But I knew in December of my intern year, hey, I'm not staying here. I'm going to Camp Lejeune with the Marines. So they also make everybody do 2 weeks of psych, 2 weeks of OB-GYN, 2 weeks of ortho, and a month in the ER. Because I did internal medicine, I never dealt with, female problems really or ortho problems. But when I'm with the Marines, I'm going to need to know that stuff. So they made sure you're kind of somewhat competent in that stuff before you just went out and did your own thing. But in my intern year is pretty normal other than that though, right? So you do the regular inpatient medicine, outpatient medicine, electives. When you're at a hospital like Walter Reed, Portsmouth, San Diego, you see active duty, you see retirees, you see dependents who are like wives or kids of active duty folks. So the population of patients is kind of like your civilian centers, but you do see active duty folks as well. So like I said, in the middle of your intern year in the Navy, you have to reapply to stay where you're at. Okay. So so in my internal medicine class, there was 17 of us and 3 people got to stay to finish residency. The rest of us are told, hey, you're going out to do operational stuff, which is definitely unique to the Navy. The Air Force and the Army don't have that. All right. Now you can apply to come back to residency after your operational tour, or you can say, I'm going to do my military commitment operationally, and then I'm going to get out and do civilian medicine. So when someone says, okay, and that's Navy Medical Center Portsmouth. Actually, it's a really cool place. It's been around since like 1830. That building on the right there, it's like a Civil War hospital. It's really cool. So when someone says, okay, I'm going to do operational medicine, or they're told you're going to do operational medicine, your options are you can be a general medical officer, which is what I am. You can be a flight surgeon, or you can do dive or undersea medicine. When you're a general medical officer, I'll just call them GMO, you're either with the Marine Corps on a Navy ship, with the Seabees, who are like the construction workers in the Navy, or you can be a shoreside clinic. If you did flight surgery, then you're going to either be with a Navy squadron or a Marine Corps squadron or the Marine Air Wing. If you do dive or undersea medicine, you do submarines, divers, or special operations stuff like Navy SEALs, stuff like that. Or like MARSOC, which is like the special ops of the Marine Corps or Marine Recon. The difference in these three are obvious, like, your jobs. If you do GMO, you graduate internship on, June 30th, and then July 2nd, you're heading to your unit. If you do flight or dive, you have a 6-month class where you go to flight school or dive school. My personal preference is I didn't really care to fly and I didn't want to be drowned. So I picked going with the Marines, which was a lot of fun. So this is what I want to focus most on, because this is like the cool part of the Navy, right? Is when you're a GMO, like, what do you do? So you get embedded in a unit, right? So you pick your orders and you say, I want to go there. And you are that unit's doctor. So whatever they do, you do. And really you work hand in hand with the commander, right? The battalion commander, and whatever he or she wants happens, right? So your job is like to work hand in hand with that commander to make sure that their unit is ready to go and drop the hat, and that everyone's healthy and ready to go, right? mission-focused medicine, right? So someone breaks their leg, your job is to make sure that you get them to whatever specialist you got to get them to make sure they're ready to go whenever a deployment is coming up. And then obviously, you're also that unit's primary care doctor, right? So any aches and pains, any sicknesses, anything, you're the person they're going to come see and ask for help. Your main goal is operational readiness, which means like we need to make sure this unit is able to deploy whenever we're told we're deploying. And that's it's a really simple job, and it's mission, right? Take care of sick people, make sure they can deploy. And the patients are, they're active duty Marines or they're active duty Navy. Like they're all very, very, very healthy for the most part. But if you have any group of 2,000 Marines, someone there is going to have leukemia or lymphoma. They're going to tear their ACLs, right? They're going to get concussions. So they need a doctor to say like, oh, no, this person's not ready. They can't go. Then also when these people do go, when they deploy or go on exercises, you go with them, right? So if your unit's going to Norway on an exercise, you're going. If they're going to Afghanistan for a deployment, you're going. The only thing that my unit did out of the country was something called Trident Juncture, which is what all my pictures are from, which was a NATO exercise in Norway, where basically the NATO mobilized like 40,000 troops out in Norway and had them, practicing going up and down the mountainous terrain. And I was a doctor in support of that. Another picture from Norway there too. But a regular day, like I said, it's simple, right? So you show up and you see sick call. Sick call is like the urgent care, right? So my belly hurts. I broke my leg. I have this rash. Hurts when I pee. The regular Marine Corps stuff. So you deal with that in the morning, and then you have chronic patients, right? Okay, that guy tore his ACL, had surgery four weeks ago. Let's see him, make sure he's doing okay. That guy was started on blood pressure medication. Let's make sure that it's better. And in that continuity stuff, there's operational stuff like if people are going to transfer different commands, you have to make sure they're fit and can be transferred, stuff like that. And then your afternoons are meeting with your leadership, right? So your job is to be the doctor for the commander. So in the afternoon, you meet with the commander and say, hey, sir, ma'am, I got these 10 patients that I don't know if they're going to be useful to you with the upcoming mission. They'll meet with you and say, hey, doc, we got this exercise coming up. I need you to plan training, or I need you to plan a contingency plan if someone gets really sick, right? So, and you have leadership like Navy. So when you're at the Marine Corps, all the medical is Navy, right? So you have a doctor and you have what's the corpsmen. And the corpsmen are the ones who are actually with the Marines everywhere. And then they kind of report back to you. I'll talk a little more about that in a second. So like this last picture, those containers on the ground are called AMOLs, or they're parts of AMOLs. And when people are deployed, like all the medical supplies come in that. So that's all my corpsmen packing up all the medical equipment before we went home. And these are me and some of the corpsmen and actually there's a dentist and a psychologist in there as well, just hanging out in one of our clinics in Norway. But so, I mentioned like the basic part of being a doctor, right? You see sick call, you see patients, you talk to the commander. But it's more than that, right? So your clinic is staffed by you, the doctor, a bunch of corpsmen, and that's it, right? So these corpsmen are enlisted medics, right? Who have some training in medicine, but they're not doctors, right? They're not nurses. But they're expected to know a whole lot because they are the ones who are in the field with the Marines, right? So if a Marine breaks his leg or gets shot or gets blown up, the corpsmen are the ones who put them back together and get them to like the adults, right? Like the orthopedic surgeons and the trauma surgeons. and get them fixed. So the corpsmen are on the front lines, like doing all the stuff. And not every Marine gets blown up, right? And Marines do get pneumonia, and they get retropharyngeal or peritonsillar abscesses. They get leukemia, right? So these corpsmen need to know like basic stuff to be like, ooh, this guy does not look good. He needs to go back to the rear. So my job as a doctor is to see patients with these corpsmen and show them stuff like, hey, if you ever see this in the field, get them away from you, get them on a helicopter, get them medevac, get them somewhere safe. And you're in charge of the clinic, right? So you're in charge of teaching people, you're in charge of making sure the clinic runs smoothly. And you're also supervising. So most battalions will have a doctor and also physician assistants or independent duty corpsmen, which are corpsmen who went to like miniature PA school, who can kind of see patients on their own. And they're more movable than doctors, right? So I'm never going to put a doctor like on the front lines, but they'll put corpsmen pretty close to the front lines or on the front lines, and independent duty corpsmen pretty close to the front lines. And then, like I mentioned, the force readiness and the operational planning. That's just extra stuff that you don't learn about in med school, and that you have to kind of learn on the fly. So, kind of back to like being a med student and trying to decide like, is the Navy right for me? And I didn't have really doctors to talk to be like, should I join? Should I not join? And you can Google stuff all day and hear all these crazy people on Student Doctor Network or whatever that are like, oh, yeah, no one does GMO tours anymore, or recruiters will tell you can be trained in whatever you want, and don't trust anybody. All right, get multiple opinions, but the facts are that GMO tours are not rare, right? Like you're gonna do one, all right, unless you're just the top 2% of all the internship class, like you're going to probably do an operational billet, especially if you want to do something like, ENT or dermatology, you're going to do an operational tour. Okay. If you want to do something like ortho or ER or gen surg, they really need those people, right? They really need those type of war fighting specialties. So they just kind of try to pump those people through so they can keep them on the front lines, right? But like if you're going to do endocrinology or something, yeah, good luck. I mean, you might be able to do endocrinology eventually, but you're going to do operational stuff. People will say, the Navy won't train me in X, Y, or Z. It's kind of true, right? So like it depends on the needs of the Navy, right? So if the Navy doesn't need hematologists, oncologists, they're not going to train them, right? If they don't need rheumatologists, they're not going to train them. So if you're dead set, like I want to be a radiation oncologist, well, the military might not be the best way for you to do that. But if you're like, I'll be whatever, or I'll delay my training and do Navy stuff, the Navy is perfect. The military decides what you specialize in. Never. They can never make you specialize in anything. They can say, no, we're not going to train you in plastic surgery, but here's general surgery. Do you want to do that instead? And if you accept that, that's your decision. But they're never going to say, no, you can't do plastic surgery. Why don't you do psych instead? That's never going to be a thing. You won't deploy. False. Everyone will deploy. You might not deploy to Afghanistan. You might not deploy immediately. But in order to, they're gonna get what they signed for, right? So like they want people who are movable and can go to overseas to take care of patients. You will deploy in some capacity at least once, right? And I've been lucky that my deployments, right, were just exercises. So it was like I never was in danger or anything. So there are some, travel is better than other places, but you will go somewhere for sure. The misconception is you don't make very much money. Depending on what you do, right? So if you want to be a plastic surgeon, you're not going to make the same amount of money in the military as you would in the civilian world. If you want to be a pediatrician, the money is about the same, right? So you're never going to be poor, right? You're going to have plenty of money. But yeah, I mean, financially speaking, if you're in medicine to make money, which you probably shouldn't be anyway, But if you are, you're not really going to make a killing in the military. Some more corpsmen and some Norwegian guys. We jumped in the water, really cold. Some of the Marines in their muddy little camp. This is a town called Trondheim in Norway. It was like the nearest town to us. Really pretty, obviously. That's like the camp. The Marines had tons of camps, but that's one of the camps. It's actually in Sweden. It's a cool waterfall. Some of the Norwegian nurses with their ambulance. Trondheim again. Just kind of showed where the layout was. We were obviously in the sick camp. We were in charge of so a lot of the Norway stuff was like, they call it war gaming, right? So like pretending there's a war and they're making movements and stuff. And so there were a lot of doctors as part of that, right? So they have what's called shock trauma platoons, which are like mobile trauma teams, right? They have surgeons and anesthesiologists and full nursing capabilities and ICU and ventilators, and they would pack up and move. They didn't actually need those, right? No one was, getting hurt. So they were just practicing like packing and moving. But for our role, we were like back in the main camp for people who were actually sick or hurt. So we had like a 197 bed like hospital. It was like, people who had gotten hurt and had surgery or whatever, they'd come back to us and we would, watch them and make sure they were better and then get them back, or if they had frostbite or trench foot or, just diarrhea, whatever. We would just bring them in and take care of them and then get them back to where they needed to go. US, Italian, Spanish, Norwegian, Canadian, it was all kinds of people. It was German. Another one of I think it's the same camp actually. So as a pre-med student, what can you do? Just talk to people, right? Beware of Google, beware of recruiters, but talk to everyone that you can, right? And ask as many questions as you can. Talk to all the branches, right? Maybe my conversation scared you. You're like, I don't want to do operational stuff. I don't want to do GMO. Okay, talk to the Air Force, talk to the Army, or don't talk to anybody. You don't have to join. And don't trust recruiters as all knowing, right? So they mean well, they're not trying to like screw anybody over, but they don't know a lot of stuff, right? Oftentimes they're not doctors, right? They haven't done it, so they just don't know. If you want to be a dermatologist, find a Navy dermatologist and talk to them, right? What was it like? How much operational stuff do you have to do before you got dermatology? Just ask the questions and find out what questions or what like about it makes you uncomfortable. And ask them, right? Just everyone's very nice. You just ask them straight up. I'm uncomfortable because of this. What do you think about it, right? If you decide that the military is for you, start like ASAP because you want your payments to be ready day one of your first year of med school, so you don't have that stress just like off your plate, right? And you can just get the money and worry about studying and not worry about anything else. The application sucks. It's really long. That your recruiter will help you with that for sure. But just make sure you start as soon as you possibly can. Like the day you get into med school, get it going. And you can always, I think I was telling Grace, you can always apply. And then if you're like, I don't want to do this anymore, then just don't sign it. Just stop, right? But do be wary of signing anything, right? Once you sign something, it's legal and it's happening. So things like to just like think about, right? So why did I join? What's good about joining? Serving your country, right? That kind of has to be like your main thought process behind it, or else it's going to be a really miserable time. You have to want to serve. You have to want to be with the people, the patient population, which is a really cool patient population, right? Like I've seen guys who have been all over the world and done a lot of stuff for our country, and it's incredible to be able to take care of those people. Obviously, financially, right? There's no loans and you get paid. That's obviously a plus. You're going to have adventures, right? So I went to Norway. I did other field stuff in the U.S. It wasn't always really fun, but it's interesting, and it's something that no one else is doing. And say that you really wanted to do dermatology or something, and you're like, oh, my board score really isn't up to par with dermatology. Join the military and getting out of the military kind of ekes you up, right, on the application process. So you're definitely going to be a competitive applicant once you do get out. High speed, low drag is stuff like the military that say, meaning like if you want to be on a helicopter and treating medevacs, right, like as a surgeon or as an anesthesiologist, there's nowhere in the world you can do that other than the military, right? We have teams of doctors that are in airplanes that are doing surgery, right, that are stabilizing patients. That's crazy. And you can't do that anywhere else. And the military has great benefits, right? The free health insurance, just all the perks of being in the military. There's rare attending jobs, right? You can be the surgeon in charge of the continent of Africa, right, and all deployments. You can be, like I said, on the shock trauma platoon where you deploy and you move this trauma bay around. You can be on a ship and go from port to port to port to port. And then the insurance and liability, right? So you can get sued in the military, but you really got to mess up, and it's not as common as it is in the civilian world. The cons, all right, so you're going to move, right? So I haven't lived in the same place for more than 2 years over the past 5-6 years, and it's annoying. Being from the Midwest, I just want to go home, and there's not a lot of ocean in the Navy or in the Midwest. So the Navy is it'll keep you where they want you. You're not in charge of your life, which you kind of have to accept that, which is fine, right? You're not going to go to horrible places, but you're going to be moving. And like my wife's a school counselor, and like right when she gets settled in a job, we're moving again, and so it's hard, especially if you have family. If you're in the Navy, there's going to be a delay in your career, most likely, right? So like, for example, like I'm behind. My classmates all finished residency last year, and I'm still have to go back and finish residency because I've been doing operational stuff. But if you're young and you're okay with that, then by all means think about it, right? There are limited spots and specialties that you can do, right? So if the Navy decides they're not going to train eye doctors, you're not going to get trained as an eye doctor in the Navy, right? So you have to be okay with that. If you're someone who's dead set, like I've always wanted to be a rheumatologist my whole entire life, I can't imagine doing anything else. I have to be a rheumatologist in the next 3 years or whatever, 6 years. Well, the Navy's not going to probably be the place for you. You got to be flexible, right? So if you're from Idaho and you really want to live in Idaho, Navy's probably not a good idea. And there are salary differences, right? So like I was saying, the different specialties are gonna make different, right? You're never gonna be poor. You're always gonna have money, as much money as you really need. But if money is a big draw for you, the military is really not probably the way to go. So just like to summarize that, right? So if you're looking for the free ride and that's your only incentive is I just don't want to pay for school, you're not going to enjoy the military. You're going to be resentful and it's not going to be very fun. And it's you can do that, but it's just you're not going to be very happy. But if you're looking for an adventure that you're going to grow as a leader, you're going to have different roles that you never could have possibly imagined, and you're okay with that little delay in your career, then do it, right? And look into it and talk to different branches and different recruiters and physicians in your specialty, and consider doing it. I put my email there. You guys can always email or text. I don't know if there's my phone number or not, but like I said, I would have loved to have a doctor that kind of explain this straight up to me, because you're always kind of getting the runaround, and knowing just the honest truth about how it works and stuff, I think is really beneficial to people trying to make a decision like that, because it's your life, right? So definitely ask me or anybody else if you have any questions. I think that's all I got, guys. I don't know how fast that was.
Oh, that was amazing. And I think this slide for questions is really good in case people in the audience, in case we don't get to questions that you asked today. This is a resource for later on. We're going to try and go through as many questions as we can in the next 20 or so minutes. The first question I have for you is, you speak about being a GMO is almost as a delay, right? What's the end goal? Like, what do you want to end up in ultimately?
I just want to be a hospitalist, right? So I just want to do internal medicine and be a hospitalist.
That's
Um, I've learned like so. Your main goals, your main job at GMO is like teach the corpsmen, and I really, really, really enjoy that. So I think I want to go back to like a somewhere where there's med students or residents or whatever, and get into like academic hospitalist type stuff.
You like teaching. Do you also like, I was thinking about this with your day in the life with the guys you take care of. Do you have a role in teaching them about preventative care as well?
Yeah. So there's a ton of that. So we actually are. We have to see. We have what's called periodic health assessments, which every year I have to see every patient once. So I have to sit down with every single patient, every single Marine, sailor, whatever, and just kind of talk about their tobacco use, their alcohol use, their family history of stuff. So that's how we do individual preventive medicine. But then for like when we're going on a deployment or an exercise, we'll give lectures to the Marines and say like, "Hey, you idiots, don't wear these gloves," or don't touch that bug, or don't kick that. You know what I mean? So it's like wherever you're going, you'll give lectures about what to do when this happens or that happens, or how to avoid heat stroke or cold injuries. So yeah, there's a lot of that.
Can you talk more about the difference in your day-to-day life, like being in clinic here in the United States versus being deployed?
So people love in medicine, people love the deployments because you don't do anything like 90% of the time. But when you do stuff, you do like bad. You know what I mean? It's like, oh boy, here we go. Because when you're deployed, guys and girls don't want to see the doctor, because then that means they can't do whatever they're doing, right? So they just try to stay away from you as much as they can. And when they come and see you, something's wrong, right? So we'd sit there all day and do nothing, play Monopoly, look at YouTube videos, whatever. And then 2 a.m, five guys would storm in because something happened. You know what I mean? So it's kind of like being in an ER that you can't leave, because it's just whatever shows up, shows up. Now we never, most of the stuff, it's higher acuity when you're out there, right? So like I think we had like 7 appendicitis while we were there. But there's not as many like, my belly hurts or I have a sore throat, because there's like, I'm just gonna deal with this on my own. In the US, it's a lot of my throat hurts. I twisted my ankle, stuff like that.
Do you anticipate deploying again? Or what's the plan there?
I don't. So typically, each operational billet that you have, you deploy with. I kind of got into a stateside clinic here where I'm not really attached to an operational unit. I'm more of a doctor for like the school and the base here. Now, if something happened, right? So like, so for COVID, I was put on a list to deploy in support of COVID, but they ended up not needing me, so I didn't go. Obviously, if a war, like a big new war breaks out, I will probably go. But like my unit now is not going to deploy, so I don't think I'll go anywhere. But you gotta be flexible. You never know.
Absolutely. Down the line, you think after you've kind of adjusted to being a hospitalist, do you think that you'll continue to work at a military hospital like Walter Reed, or do you think you would transition to civilian medicine?
I'm getting out next summer.
Okay.
And like I said, I just want to go back to Missouri. But I have thought about the reserves. The reserves is interesting. because you can kind of pick and choose, like, ooh, that sounds like a nice opportunity. I'll go and do that. And I've thought about that just because I'm afraid I will miss like the patients. I love like working with the Marines is a huge headache because they're Marines, but it was a lot of fun at the same time. So I am a little afraid I'll miss it a little bit. So I might join the reserves after, which is an option. And then in which case you would deploy, you know, like say I was a trauma surgeon and I was in the reserves and they said, oh, we need a trauma surgeon now. And I would say, oh, I'll go. And they'll pick the trauma surgeon and say, go be a trauma surgeon in Afghanistan. As a GMO, right, your deployments are, you're a GMO, right? You don't operate on anybody. So when you're in the reserves, you'll deploy as your specialty, you know?
Yeah. You like working with people in the military. I remember shadowing at Walter Reed. Like one of the coolest things was meeting people with amazing stories and amazing attitudes. Is that like something that really drew you to military medicine, or like what drew you to medicine and specifically Navy medicine?
I honestly didn't really think much about like, I don't know. I didn't at the time. I didn't think much about like who my patients were going to be. I don't know. I didn't really think about it. It has been a cool part, right? Like seeing guys who, you know, and now we don't have a lot of combat going on. Like in like 03, 04, 07, you know, there was a lot of stuff. So my older Marines, you know, had been in, you know, a lot of real heavy action. And so talking to them was fascinating, and just seeing how different people, you know, respond to that type of stuff, and hearing some of the stuff that they, you know, were a part of. But what drew me really was kind of like the adventure of like, oh, I'm young, you know, put me wherever. And you know, I wasn't a deep thinker, and I kind of was just like, oh, cool. You know, I guess it's like the patriotism of it was like drew me. Why I picked the Navy is because I talked to one doctor who he said, have you watched Band of Brothers? I was like, yeah. He's like, did they give you goosebumps? I was like, yeah. And he's like, then join the Navy. So what do you mean? He said that, you know, the Navy has, like I mentioned, has the most like operational stuff that you'll do, right? So the Navy really, again, I don't know a ton about Army and Air Force medicine, but it's kind of, the medicine part is a little separated. But with the Navy, like, you know, I lived with, you know, the Marines, and you just feel more a part of the unit, I guess is what I would say. I'm sure there's Army billets that are similar to that, but there's a lot of them in the Navy, right? Like every operational person is with their unit.
Yeah. Can you talk more about like that culture? And you know, you didn't necessarily go through the same exact training as the guys you're with. Did you feel like really a part of that? And what was it like being so?
So the Marines love their docs. They call their corpsmen doc, and they love those guys and girls. Like a good corpsman is worth their weight in gold. So as long as you're on the Marines' good side, they love you, and they would like defend you to the death. But you know, you can piss them off too. And they don't have the same expectations as us, right? Like, or for us, if they do their Marines, right? So like, if my first day I showed up, I wore my uniform on because I didn't know what I was doing, and they're like, "Hey, doc," right? I'm like, "Oh shit," you know. So they get it, right? Like we're a doctor who happens to be wearing a uniform, right? So they have some leniency with us. What's cool about the Navy and the Marine Corps is you can get something called FMF qualified, Fleet Marine Force qualified, where basically it's like a bunch of tests and physical fitness stuff and like gun ranges and hikes and stuff where you get qualified to wear this pin on your chest that shows like, I did this, I've been with the Marines, like I'm part of you guys, even though I'm in the Navy, right? So that's kind of like your initiation. And you know, and once you have that, you're kind of like more legit than somebody who shows up and doesn't have that.
Gotcha. We have a couple more general questions about education and that journey that you take to military medicine. The first one is about residency, and you mentioned that you find out earlier. Are you part of the same match process? Are you in the same system? Do you go through a different application? What's that like?
Totally different system. But so it's similar. It's just like a mini version, right? So, you guys in the civilian world might apply to 80 programs and interview at 30 and, rank 25 or whatever. For us, you interview at like 3 and you rank like 6, and best of luck. But the applicants, there's fewer applicants for fewer spots, obviously. And it's a totally different system, right? So you have the Navy system and the civilian system are totally separate. And then you just get an email at like, midnight or whatever the day it comes out, and you're like, oh, this is where I'm going.
Another question from Laura in our audience. She asks, can you comment on the limitedness going into the military route if you're interested in competitive fields that are less traditional?
Can I get an example of a competitive field that's less traditional?
I am gonna guess that she meant something like you were talking about earlier with like radiation oncology or something.
Okay. So it's gonna be very competitive because they may only have one training slot every 2 years or something, right? You got to think about it, right? The military is a war-winning machine, okay? We're not really there to treat lupus and rheumatoid arthritis. Now, it comes up, right? Like you have active people who get lupus, so you do need some of those people, but you don't need 30 radiation oncologists floating around the military, right? So, it's, to be totally blunt with you, if you want to do that, it's gonna be really hard. It's not impossible, right? People do it, which is why I tell you to find a active duty military person in your specialty and ask them about their journey, because everything's going to be different, and timing's huge, right? Say there's 2 red onc doctors who retire the same year, the year you're applying, yeah, you might get it, right? But say they just trained 2 of them and they're going to stay in for another 15 years and you have to wait 15 years to get it. It's kind of like, that's rough, So it's very time dependent. It's very specialty dependent. But you got to think, right, the stuff the Navy really wants: ortho, ER, anesthesia, gen surge, trauma surge, family medicine, psych. They're gonna have a ton of those, right? Because they need them. The ones they don't need, they're just not going to train them as much, which financially makes sense.
So when you're done with your time in GMO, do you have to reapply to residency or?
Yep.
Okay, yeah, that's how that works.
Yep. So I get to redo internship and everything. So
since you redo it, do you have like a better chance of going back and getting what you intended?
I hope so.
Okay.
I think so. Like you got to think that as someone, I've been practicing medicine by myself for 4 years. So I'd like to think that I'm a more confident clinician than someone who just graduated from med school, because I've been having to do it by myself. But I've also been away from academics for 4 years, right? Like, if I have a sick Marine or a sailor, I get them as far away from me as possible, because like I'm not really capable of treating advanced stuff by myself. So there's both, right? You have that gap of being like, I don't remember how to do acid base or intubate a patient or whatever, right? But if you got a sore ankle on your guy.
What about, have you considered like a civilian residency after this? Or?
Yes, you have to do civilian. Well, you don't have to. I could go back to the military, but I'm getting out, and I'm like, did my time, and so I'll go back to the civilian world.
So shifting a little bit, Could you speak about your work-life balance and what that's like as a GMO, but even just as a doctor in the military?
The work-life balance is way better in the military than the civilian world. Yeah, I mean, unless you're deployed, life's great, right? Like you're gone at 3, you know. If you have meetings, maybe you stay till 5, right? There's no weekends. You don't work weekends unless you're deployed or in the field. Then you'll work weekends. In general, I think a lot of people, doctors, stick around the military because it's really a patient-wise, it's pretty cush, right? Like, obviously, if you're a surgeon, you get called in at night, you got to operate, right? But like the patient load is less. You get to spend more time with patients. I had a patient this week tell me that like they were so grateful that I had taken the time to explain a diagnosis because I can take a half hour with the patient. You know what I mean? Like I don't have anybody breathing down my neck being like, let's go, see more patients, see more patients. I can, if I want to take 45 minutes and talk to somebody about what they got going on, I can. In the civilian world, it's, let's go, let's get this stuff going. And you're very timed. And you're going to work weekends and you're going to work nights. In the military, GMO life is awesome in terms of like home life. Not pumped about going back to residency and losing my weekends.
So my last question for you would be, if you were 20 years old or 21 years old, like we are now, what advice would you give yourself applying?
Find out what makes you uncomfortable about the military and ask people about it. Whatever you think you might want to do, ask that type of doctor. You're never going to know without asking the questions, right? So, my dad's regret was that he's kind of just like didn't do it, right? And then the rest of your life, you had that regret of like, oh, I could have. Or if you rush into it and you didn't ask the right questions, then you're like miserable, for however many years. Just know what you're doing, right? So ask as many questions to whoever you can find about how you think or about what you can expect when you're in. Everyone's path's gonna be different depending on the person, their age, their temperament, their career that they want to do. Find what that is for you and if it fits for you. And if you don't want to do it, don't do it. Like there's no harm in not doing it. But if you want to do it, good, have fun. It'll be a blast. You'll learn a ton, and you'll do a lot of stuff you never thought you could or would do.
Absolutely. And you have been extremely transparent with us today. And I can't thank you enough for coming on here and talking to us in that way that is exactly what you're telling us to look for. So I really appreciate that. And that's all we have for questions today. If Magdi has any other announcements.
Yep. Just again, our quiz form is down below. Make sure to take your time and fill out those essay questions so you can really reflect on what Dr. Mike said today. Also, make sure to follow us on LinkedIn, like and subscribe, and go to our link tree for all future announcements. Again, we want to thank Dr. Mike for coming on today, and we really appreciate all the information.